a lot of people popping in now, so I'll go ahead and get started. Good morning, everyone. Happy Friday. I appreciate you taking the time out of your day to spend some time with me to discuss this topic. It's a bit of a sensitive topic, I know, but I think it's one worth sharing and having conversations about. Let me make sure I'm recording, though, before I get going too far into this here. There we go. Okay, good. The last training I did, I forgot to record, so I'll make sure that I got it going before I get going. A few more people popping in. All right, so please put your email address in the chat if you have yet to do so. This is a way for me to send you the post survey, and that's how I get feedback from everyone about the trainings and any potential topics you want me to cover. So please fill that out if you have time to do so. It really does help me curate these trainings for you and make sure that I'm getting things that you guys are interested in learning and that you need to know. So please put your email in the chat so I can send you that after the presentation today. And so we're going to talk about suicide prevention for caregivers. So in a previous life, before I worked for Alabama Lifespan Respite, I was the suicide prevention educator through Crisis Services of North Alabama for Huntsville City Schools. And the information I'm going to share with you today is hopefully you'll never need it, but statistically, there's a good chance that you will. And so a lot of my information today is going to be pretty stat heavy. I think it's important for us to know how prevalent suicide and depression is, especially for caregivers. And at the end, I'm going to give you all some resources. So if you need to grab something to jot some information down, now's the time to do so. But if you're driving or you don't have access to something or you're not feeling like writing it down, that's fine. These trainings are always recorded and posted online, and I'm more than happy to share my sources with you. If there's something that popped up on the screen, you get a chance to write it down, just let me know and I'll send you that information. But a lot of the resources I have for you are going to be at the end. So just stick around and get those resources so that way, if you need them, you have access to them. So our agenda for today is we're going to talk about some depression stats for caregivers. We're going to talk about the symptoms of depression and some special caregiver concerns. I'm going to highlight some concerns depending on your care recipient situation and who you are. There's going to be some information there for you. Then we're going to touch briefly on the whole health approach, and we're going to end with finding resources and supports. I do want to let everyone know I try to be sensitive with this topic. I don't want anyone to feel overwhelmed with the information. But if you feel like, it's a little bit too much or it hits too close to home and you need to step away, that's perfectly okay. I understand. I don't know where everyone is on their journey or where they are mental health wise, but I do know sometimes things can kind of creep up on you and you don't realize it's going to affect you until it does. So if you do need to step away, that's totally okay. It's not going to hurt my feelings. And if you need to touch base with me afterwards, please do not hesitate to reach out. All right, so here's some stats. It's going to be kind of heavy in this first portion. Please bear with me. The goal here is not to bore you with percentages and numbers. It is to make you aware of the prevalence of depression, suicide, because I feel like it's one of those topics we don't like to talk about. We don't like to bring it up. There's a lot of shame around this topic. And I'm just here to let you know that it is not as uncommon as we would hope it was. And if you do feel some of these symptoms, if you do feel depression, or if you've ever felt suicidal, please know that you are not alone, okay? Because I think that once we bring these things into the light, it's a lot less likely that we're going to feel shame about them. And so that's really my goal with all these statistics, all right? So a lot of the information that I got for this presentation came about after the pandemic. So when COVID hit and everything shut down, caregivers were hit really, really hard, which of course I'm preaching to the choir here. A lot of the social supports were not available. A lot of the respite opportunities were shut down. And so there was a lot of mental health crises coming out of the caregiving world. And so the government decided to do a lot of different studies because of that. And so a lot of my information is post-pandemic information. So an estimated 47.9 million adults in the United States, that's 19%, Provide informal care to adults with physical or mental health needs. So that statistic is just for adults. It does not touch on children. So if we add them into the mix, it's even more people in a caregiving situation. So of course, this is unpaid work that includes a trip to the doctors, feeding, bathing, toileting, all of that. And that is estimated at $470 billion per year. And that's equal to 3/4 of the entire budget for Medicaid. Okay, so that's a lot of money. And even in the best of times, the vast majority of the work you all do is invisible, it's unsupported or undersupported, and that leaves millions of people just like you struggling in silence. So some caregivers may bounce back from things like the pandemic or setbacks and mental health challenges that you all face, but others will likely to continue to struggle even as supports have returned post-pandemic and they found resources. Okay, so stress and worry is still going to affect caregivers negatively, especially if you were in a pandemic situation and it was shut down and it caused a lot of worsening of symptoms, either physical, cognitive, or emotional health. And the person that you're caring for, that is an additional stress on you, right? Because now you have to manage their stress as well as yours. So mental health of caregivers can also have serious effects on the people that you're looking after, right? Researchers have found over the years that conditions like depression and anxiety, they tend to lead to lower quality of care. There was a recent study in China done, and they discovered that stroke patients were more likely to die within 6 months of discharge from the hospital if the person caring for them was experiencing anxiety or depression. Okay, so I'm just going to briefly read through some of these statistics for you. So a conservative estimate reports that 20% of family caregivers suffer from depression, and this is twice the rate of the general population. Okay, so right there you can go ahead and say I'm already at risk just for being a caregiver. California's Caregiver Resource Center did a report and said nearly 60% of their caregivers showed clinical signs of depression. And what that means is if they walked into a doctor's office, their symptoms would warrant a clinical diagnosis of depression. Okay, so that's not just the blues, that's not just feeling sad or having a bad day. That is something that can be addressed medically and through therapy. Okay, so clinical diagnosis, that's 60%, that's more than half. Nearly 31% of unpaid caregivers report seriously considering suicide in the preceding 30 days. And you compare that to the general population, that's only 11%. Okay, so a very high increased risk. 40% reported having passive suicidal thoughts. And that's just kind of like wishing that they had gone to bed or didn't wake up, right? Or, oh, if they say things like, I don't want to be here anymore. Okay, so that doesn't mean that they're actively suicidal, but they're it's passing through their thoughts, right? That's what passive suicidal means. 72% of people say they feel alone as an unpaid family caregiver, and they have high emotional stress. 2/3 of caregivers said that they experience mental health challenges, so like anxiety, depression, or suicidal thoughts. And only 1/3 of people with no caregiving responsibilities reported the same symptoms. Okay, so you see the increase there. People who are caring for both children under 18 and adults, so the sandwich generation, they are faring the worst. 85% of this group experience adverse mental health symptoms. So that's pretty much everybody, okay? Over 30% had seriously considered taking their own life. And that's about 5 times the number of non-caregivers. So you're seeing a pattern here, right? And 41% of former caregivers of a spouse who had Alzheimer's disease or dementia experienced mild to severe depression up to 3 years after their spouse had passed away. Okay, so this is a long-term situation they're experiencing. So I hope I didn't, bum you out with those stats. But again, the purpose of sharing that with you is to let you know that if you feel like you're in this space, right? Or if you feel like you're immune to this space, these feelings, you're not, okay? This is a increased risk for suicide and depression in caregivers simply because of the emotional stress and anxiety that comes with caregiving, okay? So people, of course, experience depression differently in different ways. Some might feel classic symptoms like sadness or feeling hopeless, but others might have signs that we don't equate with depression. So like extreme fatigue or irritability. The type and degree of symptoms vary, of course, by each individual, and it can change over time. So here's some common symptoms of depression. And as I go through these, I want you to think, have you experienced any of these for longer than 2 weeks? Okay. So feeling sad and tearful, empty or hopeless. Have there been changes in your eating habits? So that could mean weight loss and no appetite or cravings, or weight loss or weight gain, excuse me. Changes in your sleep, too much sleep or not enough sleep. Okay, and again, you're looking for changes, not necessarily like, well, I only need 6 hours of sleep. That doesn't mean you're depressed. Okay, if you've always been a short sleeper, always been rejuvenated, that's fine. But if you used to be okay with 6 hours of sleep and now you need 12, okay, that's an indication. So if you're looking for drastic changes. Feeling tired all the time or having difficulty to be motivated to do anything. Loss of interest in people or activities that once brought you joy or pleasure. Okay, some things that maybe you enjoyed doing your book club every month and now you don't want to be bothered, right? Or maybe you enjoyed walking, or doing your exercises or whatever it was that you do, and now you don't want to do those things anymore. Feeling numb, that's a sign of depression. Becoming easily agitated or angered. Spending too much time on the internet, right? We've all heard of doom scrolling, where you're just kind of disassociating and just kind of flipping through, post after post after post. Okay, that can be a sign of depression. Are you having trouble focusing, thinking, planning? Like your head is kind of filled with that fog, that brain fog. Of course, these could all be symptoms of maybe poor diet or poor sleep, things like that. But if you're experiencing it for 2 weeks or longer, and this is not your norm, then it may be time for you to consider that this might be depression, okay? Are you neglecting your physical well-being or your appearance, right? Are you having a really difficult time maintaining your hygiene? That's a big indicator, especially with my kiddos when they start to go through these kind of bouts of depression. I notice that they don't take care of themselves like they normally do, so that's a sign. Thoughts of running away or escaping from the situation. You guys ever feel like you're just going to walk out your back door and keep walking and no one's ever going to see you again? Okay. Thinking about death or suicide or having ideas to end your life. Ongoing physical symptoms that don't respond to treatment. So are you getting more headaches? Are you having migraines? Are you having digestion issues or disorders? Chronic neck pain, chronic back pain, okay? So of course, these can be symptoms based on your level of activity as a caregiver, right? Because sometimes lifting, moving, scooching, that kind of stuff can cause a lot of these pains, but are they not responding to treatment? Okay, that's where it's the indicator that there's something else going on. Do you feel that nothing you do is good enough? Has that been a lingering thought in your mind for 2 weeks or more? And have you had an increase in your alcohol or drug consumption, right? Oftentimes when we're not feeling our best, we like to numb or distract, and we can use substances to do that, okay? So I'm not going to quiz anybody or have anyone share with the class, but just think to yourself, if you've experienced any of these for longer than 2 weeks, you might be at risk for a depression episode, okay? So we're going to talk about some special caregiver concerns, and we're going to start with dementia. A lot of people on the call today and a lot of people I talk to, they are caring for people who have dementia. And we know that this can be all-consuming, right? Research has found that a person who provides care with someone with dementia are twice as likely to suffer from depression than a person providing care for someone without dementia, okay? So keep that in mind. So not only do caregivers of people who have dementia spend significantly more hours per week providing care, they report more employment problems, personal stress, mental and physical health problems, lack of sleep, especially if your loved one is up wandering throughout the night, and just not having time to do the things that they enjoy, not having time to spend with other family members or friends. And they experience more family conflict than non-dementia caregivers, okay? So as stressful as the deterioration of your loved one, their mental and physical abilities may be for you, dealing with dementia-related behaviors is an even bigger contributor to developing depression. So dementia-related symptoms like wandering, agitation, hoarding, embarrassing conduct, especially out in public, being resistant or non-cooperative, that can make every day really, really challenging, right? And it makes it very difficult for you to get rest or help providing care, right? Say, I need a break, and then someone says, well, I can't do what you do. I don't want to do those things. Okay, so it's a lot harder for you to find respite if you have someone living with dementia in your space. So the more severe the case of dementia, the more likely you as a caregiver are going to experience depression. Okay, so we know that dementia is a progressive disease, right? So maybe in the beginning, where it was easier to manage, the symptoms were not as intense. Your depression, your anxiety, your sadness, it wasn't to the level that maybe it is today, right? If you've been caregiving for years and years and years, you are at a higher risk of depression, okay? So it is very critical for you as a caregiver, especially in this situation, to receive consistent and dependable support and respite, okay? So if you find yourself in this space, you don't have anyone to talk to, you can always call me, okay? And if I'm not in the office, leave me a voicemail, send me an email, and I'll return it as quickly as I can, okay? Because I understand this is a very heavy space to be in, and you guys are at higher risk. So I don't want anyone to feel like they're being left out in the wind. I am a trained crisis counselor. I am trauma informed. So if you need to talk to somebody, I'm here for you, okay? So next, women. So women experience depression at a higher rate than men. So primarily wives and daughters are the ones who are providing the majority of caregiving in the United States. There's approximately 12 million women who experience clinical depression each year, and that's twice the rate of men, okay? So if you think depression is all in your head, you're wrong. Think again. So physical factors like menopause, childbirth, PMS, thyroid disease or disorders, nutritional deficits in iron, vitamin D, omega-3 fatty acids, that all contribute to depression, okay? So sometimes even just shifting your diet can alleviate some of those symptoms. A Mental Health America study found that many women don't seek treatment for depression because they're embarrassed or they're in denial about being depressed, right? How many times have you said, well, I'll be fine, I'll be fine, I'll be fine, I'll get through it. And maybe you do, you bear through it, you white knuckle through it. But that doesn't mean just because you get through something that you're okay on the other side, okay? So you can still get stuff done and be depressed, okay? So 41% of women surveyed cited that they were embarrassed or felt shame, and those were barriers to them finding treatment, okay? So again, my goal with this training is to let you know there's no shame or embarrassment to having depression, okay? It is a treatable condition, and you can get mental health care just like you would go to the doctor if you had, you know, a broken bone or, you know, a sinus infection or anything else, right? So keep in mind that doctors have heard it all. So it's important that you let them know about your mental and physical health, the symptoms you're experiencing, and to get those examined, okay? Take time during any doctor's visits that you might be in to bring up the subject of depression if you think that you might be experiencing it, okay? They've heard it before. Next, men. So men who are caregivers deal with depression differently. Okay, so they are less likely to admit that they're depressed to doctors and to loved ones. And so, of course, it's a lot less likely that they will be diagnosed with depression because they're not going to bring it up. Many men will often self-treat their depression, so like through alcohol or overwork. And their depression symptoms will look like anger or irritability or feeling powerlessness, okay? So although male caregivers tend to be more willing than their female counterparts to hire outside help for assistance, like with home care duties or just taking care of their loved one, they tend to have fewer friends to confide in or positive activities to engage in outside the home. And also the mistaken assumption that depression symptoms are a sign of weakness can make it especially difficult for men to seek help, okay? So again, you might not feel the sadness, you might not feel the brain fog, but maybe you're feeling more angry, maybe you're feeling more irritable, okay? Maybe you're feeling powerless, and that can be a sign that you're feeling depressed. And of course, we are very aware that the way that American culture operates when it comes to men and their emotions is that you only get to be happy or mad, you don't get to be anything else. And so you're gonna express that sadness in different ways because of how you've been culturally conditioned to think of depression or sadness, okay? So just be mindful of that. Next, if you're taking care of a veteran, okay, a military caregiver, there are some special concerns for you as well. You are at a great risk for depression. So military and veteran caregivers will experience depression nearly twice the rate of non-military caregivers. So all those stats I gave you before, double it, okay, if you're a military caregiver. The more severe the mental or physical health conditions of the veteran you're caring for, the more demands that you face as a caregiver, right? So conditions like dementia or a traumatic brain injury or PTSD, those can be particularly challenging for you as a caregiver. So you're trying to cope with daily life. And then in addition to that, you're watching out for your veterans' triggers, right? Or helping them cope with their own stress. You kind of have to become a therapist overnight almost, right? And that obviously is going to make you feel overwhelmed. And that will increase your feelings of depression, particularly if you're feeling helplessness or hopelessness, right? And that's like, I can't do anything to change this. It's never going to change. It's always going to be this way, okay? And that hopelessness feeling, I want everyone to be very aware that regardless of your caregiving situation, statistically, hopelessness is the #1 descriptor for people who have survived a suicide attempt. Okay, and that's that feeling that what they're experiencing, whatever pain they're feeling, is not going to change and it's not going to go anywhere. Okay, and oftentimes people commit suicide not because they particularly want to die, it's because whatever they're feeling, they want that feeling to end. Okay, that's what it is. They're looking for release and relief. All right. So as a military caregiver, you might not have other people in your life who understand the experience of caring for a service member. So particularly younger caregivers and their peers probably are unlikely to be facing the same kind of challenges. So maybe you've moved, right, to have better access to VA benefits, or you're in a region that's more supportive to their needs. And that can make you feel even more isolated and less likely to have help from people that you know and trust. But of course, that doesn't mean that help is not available. The first step is to talk to your doctor, who can refer you to a mental health professional. And if they need to, they will prescribe medications for you, okay? So depression deserves to be treated with the same attention that is afforded to other illnesses, right? Like diabetes or high blood pressure, right? You go and you get pills for that, you get treated for that, you change your diet, you change your exercise routine. That's the same with depression, right? So the best way to figure out what's causing symptoms is to talk to a qualified professional like a doctor. And if you feel uncomfortable using that term depression, just tell your doctor that you're feeling blue or you're feeling down, or just describe your personal experience and your symptoms, okay? The more specific you can be, the better your doctor can help you. The important thing to make is to make it a priority during your appointment, right? Don't just, oh, everything's fine, good, and then on your way out the door, by the way, I'm feeling suicidal, okay? Make it a priority and be as honest as possible with your doctor so that they can help you, right? If you say, well, I'm sad, but I'm okay, they're going to take your word for it. They're not going to probe, right? They're not going to get all up in your space. You have to be specific, okay? And it's not uncommon for a person receiving care to suffer from undiagnosed depression as well, right? Everything can feel worse from their perspective, adding to any daily caregiving challenges that you're experiencing already. So if you suspect that that's the case in your caregiving situation, where maybe not just you, but your loved one is experiencing depression, try to find an opportunity to share your concern with them, right? And of course, they may be reluctant to talk about it, but you can encourage maybe like a trusted friend to talk to them, or maybe leave a message with their doctor to bring it up during their next appointment, okay? You can do all those things. So how do we treat depression? Hopefully by now you guys see that it is very common. It is not something to be ashamed of. It is something that you can get help for and treatment for. And we're going to go over some ways that that's most commonly treated. So of course, the first step in getting the best treatment for depression is to meet with a mental health professional. So a psychologist, a social worker, or a licensed therapist. And at the same time, you can schedule a physical exam with your doctor, so you can get it all done in one blow. Certain medications, as well as certain medical conditions, such as a viral infection, can cause the same symptoms as depression, and that should be evaluated by a physician. Okay, we want to rule anything out. So an exam could include lab tests, an interview that tests for mental status to determine if speech or memory or thought patterns have been affected. So a physician may prescribe antidepressant medication, but that alone is not the most effective treatment for depression. Okay, there is no magic pill, unfortunately. But if you are getting guidance from a mental health professional at the same time, that's highly recommended for overall success. Okay, so a therapist a therapist or a counselor can listen to your concerns, screen for symptoms of depression, and can help you to develop ways to address your stress and help you build new coping patterns. Okay, so if you remember, we went back through the slide. A lot of times people will cope with disassociating, doom scrolling on their social media, alcohol, or other drugs. Okay, so a therapist or a counselor will be able to give you new coping mechanisms. Okay, so that you can help you kind of get over those stress and anxiety symptoms. Let's see here. One way to find a professional is to ask a friend, right? You can get personal referrals or someone that you know and trust and see if they have any leads. But you can also ask like a spiritual advisor if you have like a minister or a rabbi. Or you can talk to your doctor, see if they have any recommendations. But if you're employed and you have an employee health care package, sorry, you can just call them and say, who's in my network? Who can I use? Okay. Let's see here. It's important to trust and feel comfortable with the provider that you choose. And it is not uncommon to request like an introductory phone interview or in-person meeting to determine if the person is a right fit. And it is appropriate to clarify, of course, how much it's going to cost, how much your insurance will cover, things like that. Okay. And again, it is not uncommon for people to cycle through a couple different providers before they find one that fits, okay? Because yes, you're seeing people who are trained and who have the proper credentials to treat you, but personality and rapport and the way you get along with somebody goes a long way in your treatment success, okay? Because you could have somebody that has all the right tools, but you don't vibe with them personally, or you don't feel like they are understanding where you're coming from, okay? It's going to be very difficult to be vulnerable in those spaces if it's someone that you don't trust. So if you pick out a therapist, you go and it's a total bomb, that's totally okay, okay? That doesn't mean give up. That just means try again, okay? It's just kind of like dating, right? You're not going to marry the first person you go out on a date with. You don't have to commit to the first therapist you see either, okay? So how is depression treated? So of course, once there's been a review, a physical and mental health evaluation, there may be a course of treatment suggested or recommended. Primary treatment options are often psychotherapy, which is also referred to as mental health therapy or talk therapy, and antidepressant medication in tandem, okay? So of course, they could be used alone or in combination with one another. But the most frequent treatment for depression is that's progressed beyond mild stages of depression is medication. And so that can provide relatively quick symptom relief for you. I know when my mother's mother passed, she just could not get over that hump, right? She was not ever going to get over her mother passing, but she was having a really difficult time just in that space. And so she was on medication short term just to kind of clear her head, to give her some alleviation from her symptoms. And so again, if you go into your therapy office and they start prescribing you medications, please don't think that this is going to be a lifelong thing for you. It might be, but it could very well just be short term, okay? But it is very critical to treatment with depression to be seeing a psychotherapist or a counselor or a therapist to go along with that medication, okay? Discussing your situation with the therapist can open up some new self-awareness for you and addressing particular emotional concerns or provide guidance to help you address challenges and help you to get healthy and stay healthy, okay? So when you choose a therapist, make sure you ask them about their experience working with family caregivers. Because if they understand caregiver-related stressors, they're going to be a lot more likely to be able to provide you the treatment that's going to be the most helpful to you, okay? If drug therapy is recommended, a certain amount of trial and error is necessary, okay, to find the right dosage and type of medication for each person because everyone's different, right? Your brain chemistry is going to be different, your lifestyle is going to be different, and so it's not going to be a one-size-fits-all treatment plan, okay? There's going to be some trial and error involved, and that could take several weeks before you even feel the effect, okay? So this is where good communication with you and your doctor is really important. And older adults should be especially careful to watch out for medication side effects that can be caused from too high of a dosage or interacting with other medications that you're already on, okay? So it sounds like a lot, and it is, but that's okay, right? Because if this is the treatment plan, this is gonna keep you healthy, this is gonna keep you alive, right? Because untreated depression, it doesn't just go away, okay? It just festers and it grows into a very large and sometimes unmanageable beast, okay? And that's what we're trying to avoid. So here's some complementary and alternative therapies that you can use. I'm going to go through a few of them. The first one is physical exercise. So many complementary medicines and alternative therapies are promoted for coping with depression. So some have been tested in clinical trials, but many have not. But here's an overview of some of the most common therapies. So physical exercise has been found to reduce the effects of depression. So walking 3 times a week for 30 to 45 minutes has been linked to reducing or alleviating symptoms of depression. Okay, and that could be walking outside. That could be walking at a track at a community center if it's too hot or too cold outside. That could be walking on your treadmill if you have one. Okay, and of course, if you can't do the 30 to 45 minutes a week or 45 minutes a session, you can start with 15 minutes once a week, okay? As long as you're doing something, it's going to point you in the right direction, okay? It's going to get you on that trajectory. So the important message is to get started with regular exercise activity, okay? And you know me, whenever I bring up exercise, I know it's like one more thing on the to-do list, right? One more thing I have to do. But exercise can be anything that gets your body moving, okay? Swimming, dancing, jump rope, treadmill, okay? Stretching even, doing chair yoga, wherever you are, that's where you start, and that's okay, all right? So it's unknown whether physical activity will prevent the onset of depression or if it just helps to kind of modify the effects. But if you can arrange time for exercise, it is a value added activity. Okay, so that means it's something to do. It's not something that you do when everything else is done. Okay, it's something that you can do incorporated in your priorities. Okay, so you can maybe add it to your to-do list, or you can ask a friend to do like a walk date, right? So that you can hold each other accountable. Maybe even go and ask your doctor to write a prescription for exercise, okay? Join exercise class, whatever it takes. Just know that research shows that healthier life is gonna make you less susceptible to depression, okay? Next, we can talk about mind and body techniques. If you've been to any of my trainings, you know I'm a huge advocate for mind and body techniques. So there's a growing body of research that shows that our thoughts, beliefs, and feelings have a direct impact on our health and our physical health. And of course, that impacts your mental state. So the mind and the body are interrelated. I read this quote the other day, and it's talking about what embodiment is. And it's going from the thought of I have a body to I am a body, okay? So if you kind of think of yourself, I am a body, at least for me, that kind of makes me feel more inspired to take care of that body, right? Because that's who I am. I'm not just the mind, I'm not just the body, I'm both, okay? So implementing mind and body techniques into your routine may help alleviate depression. So even 5 to 10 minutes of any of these techniques can be beneficial. So meditation, right? Anything introspective, anything that can bring you back, your awareness back into your body. Prayer, that can have the same effect. Deep breathing, acupuncture, never tried it, but I'm sure it's great for some people. Yoga, having a massage, listening to music even, right? I listen to music every day. It's a great healing thing for me. Creating art or guided imagery. So guided imagery is where you can look up these things on YouTube, or Google can help you find a great website, I'm sure. And it's just where you close your eyes and you just really envision yourself in a beautiful place or beautiful space or somewhere that is peaceful to you, okay? That can help stimulate relaxation in your body. And of course, journaling. I love journaling as a theory. I'm really bad at it, but I know it's helpful, so I encourage everyone to do it. One of these days, I'll fill in the many journals that I've used or that I've purchased, but not today. All right, so how are some strategies you can help yourself, right? Because we can enlist the help of professionals, but ultimately it's going to be down to what we choose to do for ourselves, right? That's going to help us. So depressive disorders can make you feel exhausted, helpless, and hopeless, right? Negative thoughts and feelings can make you feel like giving up. And it's important to realize that these negative views are just part of the depression, and it may not accurately reflect your situation. So here's some guidelines that are adapted from the National Institute of Mental Health, and it offers recommendations for dealing with depression. So set realistic goals in light of the depression, right? So you may not be able to accomplish as much as you're accustomed to when you aren't feeling well. Just like if you have a cold or if you have a headache, right? Your expectations have to adjust, and it's the same for depression, okay? So some tips: break large tasks into small ones, set some priorities, and do what you can as you can, okay? Shame is a big factor in depression, okay? So a lot of times if you're depressed and maybe you don't have the energy or the motivation to keep up on your housework, okay? So then you look around at your house as it's getting worse and worse and worse, and you start to feel like a bad person, right? We often will see uncleanliness in our home as a moral failing. It is not. It is what it is, right? And so just be mindful that you can do what you can do, but don't shame yourself because of all the things you can't do. You have to start somewhere, okay? So start small. Try to be around other people or confide in someone that you know and trust, right? And that's often better than suffering alone. Participate in activities that might make you feel better. Again, exercise, going to a movie or a ball game, attending a religious, social, or community event. Sometimes just getting up and going to church can be all that the doctor ordered, right? Expect your mood to improve gradually and not immediately. Feeling better takes time. When was the last time you had, a flu, right? Were you okay with one dose of NyQuil? No, right? It's the same thing. Let me see if I can move this out of my way so I can read. Okay. Let's see here. It is advisable to postpone important decisions until the depression has lifted, okay? So before you make a significant transition, like change jobs, file for divorce, right? Discuss it with others you know and know them well, and they can offer you their perspective and their view on the situation, okay? You're like, maybe your husband isn't trash, girl, maybe you're just depressed, okay? So have those conversations with people you trust. People very rarely just snap out of depression. Okay, so people who expect you to do this are misguided in their understanding of your condition. Okay, you're not just gonna be happy because someone told you that's what you should do, right? It's like, oh, have you ever tried not feeling like crap? Oh no, I never thought about that, right? You can't just snap out of depression. Remember that positive thinking and the practice of new coping patterns will replace the negative thinking that's part of depression, okay? You can't just take one thing out of the equation. You have to put something else in its place. Negative thinking will be reduced as your depression responds to treatment, okay? So you don't always have to feel the way you feel, okay? You can get better. Say yes to offers of help or engagement by family and friends that you know and trust. Okay, oftentimes when we're feeling depressed, the last thing we want to do is be around somebody. Okay, at least I know I do. But say yes to those opportunities as they come up, because being around other people can help kind of lift that fog of depression. Okay, of course, if they're people you like, you don't want to be around people that get on your nerves, because then that's just a whole other situation you find yourself in. Okay, so direct assistance in providing care for your loved ones, such as respite care relief, as well as positive feedback from others. Positive self-talk and recreational activities are linked to lower levels of depression. Okay, so maybe try some affirmations. Even if you don't believe them right away, just saying them can help you feel better. Okay, look for classes and support groups that are available through Alabama Lifestyle Respite or other organizations, and they can help you learn or practice effective problem solving and coping strategies that you need for caregiving, right? Because this is difficult and we can all learn from each other. For your health and the health of those around you, take some time to care for yourself, okay? Even if, the only thing that you can do is brush your teeth, right? Good, do that, okay? If the only thing you can do is sit on your back porch and put your toes in the sunshine, good, do that, okay? If all you can do is make sure you eat one healthy meal that day, that's not Cheez-Its and, pickles out of your fridge, okay? Good, do that, okay? Start small, that's progress. Let's see. So how do you find a professional in your area? So this is where you might want to pull out your pen and paper or put in the chat that you want me to send you this slide, and I will. So you can find a psychiatrist, that is a medical doctor, and they specialize in diagnosing and treating and preventing mental illnesses, including substance abuse and addiction, okay? The APA, American Psychiatric Association, that is at psych.org. They provide free information on depression and referrals to psychiatrists in your area. A psychologist is PhD. They're licensed to practice psychotherapy, and they have special training in psychological testing. So they are all often referred to as doctor. A psychologist cannot prescribe medications. So if you see a psychologist, you'll more than likely be referred to a psychiatrist for your medications. That's not uncommon, okay? So if you go to a doctor and they send you to another one, please don't think they're pulling your chain or making you do the runaround, okay? That's just part of the process. The American Psychological Association, that's apa.org. You can go on their website and find more information about depression, or you can call the toll-free number and be referred to a psychologist, in your area. You can see a licensed clinical social worker. So they are licensed to practice psychotherapy, and they have special training in addressing the person and environment. So that means not only looking at you, they're looking at the environment you're in, the social factors, the psychological factors, the biological factors that may be contributing to where you are, okay? And they have specialized training in human behavior, family behavior, psychology, and problem solving. And they have a master's degree in social work, and they have 2 years of supervised postgraduate work providing clinical treatment. And just a side note, that's where I am currently. I will graduate with my MSW in December, and I will become licensed to do these things, hopefully here with Alabama Respite. So if you need to talk to somebody, please talk to me, okay? The National Association of Social Workers, their website is naswdc.org. And they provide free information on depression and referrals to social workers in your area, okay? Let's see here. I think that might be on my next slide. Licensed marriage and family therapists, they are licensed to practice psychotherapy, and they're trained to diagnose and treat mental health issues. They work with individuals, couples, families, and groups, and they'll often have a master's degree in counseling, okay? And you can visit their website. It's not on my slide for some reason, but their website is aamft.org, okay? And you can find their website and find a therapist in your area, okay? So those are just some options for finding somebody that can help you, professionals. So other organizations, so Medicare, right? You can call Medicare or go to the website, and they have a copy of a PDF or pamphlet called Medicare and Your Mental Health Benefits. So that was a good way for you to kind of start finding out, what's available to you, what can you afford financially, what programs are available through Medicare that maybe can help offset some of those costs for you. And then there's the National Institute of Mental Health. They provide free information on depression as well and other mental illnesses, and they provide it in English and in Spanish if you're more comfortable speaking or reading in Spanish. And the National Institute for Complementary and Integrative Health, this is a government website, and they also have some resources for you on there if you need to find somebody. Some easy phone numbers that you can call. Sometimes you just need somebody to be there in the moment, okay? There's all kinds of advocacy lines for autism, developmental disability, mental illness, peer support, substance use, okay? Wings Across Alabama, this is called a warm line for non-crisis peer support. So a warm line is different from a hotline in if you're feeling actively suicidal, you call a hotline, right? It's like a 988 suicide line that's there on the right-hand corner. Say, I just took a bottle of pills, I'm suicidal, right? That would be a hotline emergency. A warm line is I'm feeling maybe passively suicidal, right? Or I'm feeling blue, or I just need someone to talk to, okay? Now, of course, 988 is good for those calls as well, but a warm line is going to be non-crisis peer support, okay? There's a veterans crisis line, okay? It's a 1-800 number. You just press 1 and somebody trained and compassionate will answer that phone, and they will talk you through whatever crisis you're experiencing, okay? So of course, 988 is also one I just talked about. And then you can call the NAMI, N-A-M-I, that's the National Alliance on Mental Illness, I think is what it stands for. And so you can contact their helpline Monday through Friday from 10 to 10. Or you can go to helpline@nami.org and send them an email, okay? I'll leave this up just in case you need to write anything down. All right, so that's the info I have for you today. I'll go ahead and stop my share, and I will pause recording.